Hello, my name is Naomi Adler, and I am the CEO of Hadassah, the Women's Zionist Organization of America, which is the umbrella organization for everything Hadassah, including Hadassah Medical Organization and Hadassah International. I am so proud and honored to be here today opening this program where we are here to give you concrete, up-to-the-minute updates on the incredible work that Hadassah and its partners have done over the last few weeks and that you have made possible. I will start with a bit of gratitude. The outpouring of longtime donors, members, and leaders, as well as new ones, and some new relationships that have come with foundations and institutions, all who recognized our role as one of the first, most impactful non-governmental organizations on the ground in Poland, as well as one of the first to supply medical equipment, supplies, and treatments to Ukraine. Thank you. Thank you to the many chapters and regions of Hadassah who have included our request for support for this emergency campaign throughout your membership communications. And if you are representing an organization other than Hadassah's groups, we thank you and encourage you to share your partnership with us, as we know Jewish Federations of North America and the American Zionist movement have already done. Last week, we celebrated the Jewish holiday of Purim. Of course, this is not the time to retell the entire story, but as we read in the Megillah, the book of Esther, when a person and a people were at their most vulnerable, it was Esther who stepped in to save the day. As many of you know, Esther is actually a Persian name, and her Hebrew name was really Hadassah. And now here we are, many, many generations and thousands of years later, our very own Hadassah organization and everyone within it has come together to step forward to save the day, along with many, many supporters. When a person or people are at their absolute most vulnerable and oppressed, Hadassah continues to be there for them. Today, as we share updates with you on what has been going on from the outset of the crisis, I'm also grateful for each one of our panelists and speakers for the work that they have done in addition to everything else they do to help heal the world. You heard 2 weeks ago from our first delegation in Poland about the work and assessments that they conducted on the ground. Here we are today, ready to send our fourth delegation into Poland, and you will hear from doctors and nurses who have been part of the first 3 delegations to learn what they've seen, what they've learned, and how they've made an impact within the Polish public, the Ukrainians, the refugees, the medical personnel, and of course, all of the volunteers who have been working together in Poland. You'll also have an opportunity to hear about the incredible work being done in our youth Aliyah villages, where refugees have already been absorbed over the last few weeks, and a plethora of social, psychological, and educational services have been quickly set up for a growing number of young adults and their families. For our audience who is joining us from Hadassah International, you should please feel free to stay on for the Youth Aliyah portion of the program if you'd like to learn more about those efforts that are supported by the American Hadassah organization. It is now my pleasure to turn this over to Professor Yoram Weiss, Acting Director General of Hadassah Medical Organization, for an update on what our hospitals have done and continue to do in Israel. Thank you again.
Hello, everybody, and good evening. And I would like to share with you our efforts over the past few weeks. As the crisis in Ukraine started, I think each one here in Israel, and it was felt very strongly by our people in the hospital, that we cannot stand aside, especially with the history we have in Europe as the Jewish people. And I'm very proud that we took the decision not to stand on the side, but take the side of treating patients, which is the mission that Hadassah was founded for many, many decades ago. And the reason it is because it is that we feel that we need to treat anyone and our humanitarian mission is the centerpiece of our organization, no matter what your religion and what your culture is. I'm very proud that we've joined this effort. We divided our effort into three basic areas. One, we're able to contact a hospital, which is a leading hospital in Poland, who's close to the border, Lublin, and we identified them and we started working with them in order to increase their capacity in treating trauma. And you'll hear details about this activity later on. I should mention, however, that other parts of our organization have arranged also for Zoom education sessions, look at using the Zoom in order to train small hospitals both in Ukraine and in Poland in how to treat and manage mass casualty, which is a major issue, although until now, as much as I know, only few wounded were transferred into Poland, but this may change any day. The other part was that our team identified the need for physicians and a clinic in the refugee centers. And our team has taken over, together with the International Red Cross and the WHO, the World Health Organization, to be the directors of one of the major refugee centers providing medical assistance. And for this, we have both internal medicine and pediatricians who serve in these stations, and we'll hear from them. Until now, we've treated about 1,400 patients, and about 30% of them were kids. We've also sent some medical equipment into Poland, but our third part of our activity was that we were the first hospital to admit wounded patients from Ukraine, and now we are focused on helping also the refugees who are arriving in Israel, who do not have medical coverage and may have also, some of them, severe diseases, some of them have cancers, and they need treatment. And we are gathering our forces in order to assist these people also, in order to serve them to the best level of medicine that we know to give at Hadassah. I'm very proud to have all of you as our supporters, and I'm especially proud of your support and your donations, and I would like to thank you from the bottom of my heart for your support. In this camaraderie and this working together with you together for the benefit of the Ukrainian people, for the benefit of Israel, is really heartwarming, and I thank you very, very much. At this point, I would like to introduce Mr. Jorge Diner, who's the Executive Director General of Hadassah International, our international branch of Hadassah. Mr. Diner, please.
Thank you, Joran, Professor Weiss. I'm reporting here from Poland. It's day 17 of my being here in the border between Poland and Ukraine, together with incredible medical staff, medical heroes and medical leaders that came from HMO, from our beloved hospital in Jerusalem, to deal with the increasing needs of the millions of refugees that come through the border. As you probably know, because we follow this on the news, every second a child is crossing the border from Ukraine and leaving their lives behind. And I want to give, before talking about the delegation and some reflections about the delegation of doctors. We are in group number 4 already, the group that arrived today. I want to give some context to the situation as I sit here for the more than the 2 weeks that I am here. And it's really a situation that is evolving. As I mentioned in our previous conversation or event, this is an unfolding event with a dynamic that you follow part on the news and part is the way we feel here the crossing, because we are in the location, in the most central location where the flow of refugees are crossing and where we see the big bulk of the humanitarian crisis being reflected in the work that we do. And one of the things that we have seen is that the number of refugees is increasing. Of course, there are ups and downs in specific days that reflect the fear that people have in Ukraine of living because of the bombing in areas where they are located. But we also see something else, and that's something that in terms of the increasing needs that we see in the work that our doctors and nurses are doing need to be done. We see that the refugees that are coming now are those that have been already almost a month in areas that are being bombed, which means the trauma, the suffering they have, and the kind of medical problems that they bring are worse than the groups that come before, and we can only expect that it will become worse with the time in terms of the challenges that we would face, and also in terms of the profile of the people coming. The first wave of people leaving Ukraine were people who could do that on their own means, and the people that are coming now are the people who are so desperate, and even if they don't have any means, they would jump into any bus or train or any possible way of living and come to the border with nothing, with no money, with nothing, just with a bag and the clothes that they were wearing while they were being in improvised shelters protecting themselves from the bombing. So this is the context where our doctors and nurses operate. And in terms of the actions, I have to say one thing about doctors and nurses that came and are coming and are now in Poland. And I can summarize that in 3 words, which is above and beyond. Doctors perform a duty, and they have a duty that they do at the hospital, and they would do in a situation like this. But our doctors, they really understand the dimension of the humanitarian mission that they are performing, and they would not just take care of patients, they would take care of the human suffering that they have in front of them. And I'm sure that in a few minutes, you will be able to hear from them directly the kind of experiences they went through, having to deal with people who not only have medical needs, but they also have nowhere to go. They need some guidance. They need to understand how they can find a new home, a new family, a place where they can rebuild their lives. And I think that if there is something that expresses our gratitude, first of all, to all the donors and supporters and friends around the world, but through them, our gratitude to the arms and hearts in the front line here is that they would do anything to make sure that not only people are healed physically, but also they are rebuilt and that they are reborn in some way from the kind of situation they came from. We should expect in the next few weeks and several weeks, and I wish I would be surprised to see this conflict ending, but as we see this conflict becoming a longer crisis, we should expect, again, the situation becoming worse in terms of numbers, and also worse in terms of the quality of diseases and situations and challenges we face. And that's the reason that the support that we need now and the work that we will be doing will be changing as we see it progressing. And again, I want to thank our doctors for above and beyond. And having said that, I just want to I have the honor to introduce our next speaker, Diane Gottlieb, HMO Chair. Diane, the floor is yours.
Good afternoon and good evening, everyone who's in a different time zone. I'd like to introduce 3 of our Hadassah team who've recently participated in our medical missions. Keep in mind that all of these physicians and nurses are volunteering to be part of this emergency response. They have willingly left behind the safety of their lives in Israel to do this work. Dr. Yarit Rebeck, Hadassah Senior Physician of Internal Medicine and Clinical Immunology. Dr. Yarit was part of the first team that went to Medical University Hospital in Lublin for fact-finding and staff training. She subsequently was responsible for coordinating the medical care at the refugee center on the Poland border. Dr. Julie Benvenisti, intensive care nurse and trauma nurse coordinator at Hadassah Hospital in Kerem. Nurse Julie worked with the hospital staff to coordinate training and the development of trauma and disaster medicine courses. Dr. Maya Cherniak, Hadassah Senior Physician in Internal Medicine, Clinical Microbiology, and Infectious Diseases. Dr. Meir is part of the delegation that's leaving Poland tonight to return to Israel. He'll share some of the personal stories that he encountered as he treated those who've left everything and everyone behind. Let's start with Dr. Yarit. As part of the team, Your initial responsibility was to interact with the Medical University Hospital for fact-finding and training. How did you come to be involved in medical care at the Refugee Center? And what did you encounter as you began to organize the Center for Treating Patients? Dr. Yarit?
Hi, hello everyone. Hope you all see me well. First, thank you all for this meeting and this opportunity to go. Without your support, I wasn't be able to go. So thank you all. I arrived, I think, more than 2 weeks ago to Poland with the first team. And after we understand that the trauma team have no much need to be stay now, we decide to see what the situation with the refugee. I have a good connection with a CEO of an organization of Israel, and we contact him and contact another big organization, the Red Cross and the WHO, that already operate at the border point and at refugee centers. All of us arrive to these centers and to this border point and start to assess the situation. Quickly, very quickly, we understood that the main issue that they don't have doctors. They have these clinics, they have medics, but they don't have doctors there. And all the people that are staying in this refugee center are staying for a day or 2 or sometimes 3 days, don't have doctors that they can reach to. So we decided to bring more team and to join the Red Cross that work in there and collaborate with them. So I started to do shift on this clinic. And what we see there was mostly very mild illness, but also chronic disease, but also a serious ill patient that we need to evacuate to the hospital. And these clinics give them the opportunity to keep going to the rest of the European countries and not wasting time, giving this life-saving, if sometimes simple treatment like fluid, like antibiotics, like simple things that we are doing there 24/7 hours a day. There is a doctor in these clinics from Hadassah Hospital. The third group is already there, arrived today to this clinic, and keep working with the refugee. We have pediatrician and internal medicine doctor and nurses that work with us. We have very, very good collaboration with the Red Cross. They are very happy that we are there and helping them. Because they don't have enough team to put in this clinic.
Thank you so much for sharing it. Nurse Julie, we'll move on to you. You often speak about medicine as a bridge to peace, and I know you've worked with training other international groups for disaster preparedness and trauma care. Was it different working with the Medical University at Lublin? And how did you use your experiences living in Israel to prepare them for what they may encounter? How did they respond?
Thank you all for allowing me to go and help the staff at the Lublin Hospital. We were able to adapt our mass casualty workshop to the facilities that are already in Poland because of the staff that went the week before. We knew the setup of their hospital, so we were able to very quickly change and adapt our model to what they would need in Poland. I sent a PowerPoint. If someone could put the PowerPoint up, and I can show you quickly what it looked like. Thank you, Gidon. So this was the hotel that we were in. It's obviously a very Jewish hotel, and it started from hundreds of years ago. and was used to be a yeshiva. Next slide. And this is in the lobby. These pictures are in the lobby of the hotel. And the hotel is very geared towards the Jewish population. Next slide. And this is me standing in front of the hospital before we went in. Next slide. And this is us giving an example of what a mass casualty looks like. And I very emphasize how many people there are, workers around each individual casualty that comes in. This is our trauma unit at Hadassah Hospital. Next slide. What we really tried to do, as you can see on the right-hand side, is that we did a tabletop drill. We actually drilled the team in how they can arrange their setup for mass casualties. And our experience here at Hadassah was very fruitful in that we could really talk from our soul of how we were geared to and how we hope to help them in their endeavor, in hopefully they will not have mass casualties, but how they can cope. Next slide. So this is us in the drill, and everyone took part of the drill. It was interactive. It wasn't just us speaking, it was them speaking. And in the end, I was asked to continue educating them through Zoom, and we've established a Zoom connection where I will continue giving educational courses to the nurses and medical staff there. That's it, Diane. And this is Lublin at night.
Thank you so much, Julie. I'm sure they appreciated not only your experience dealing with this in Israel, but the fact that you were helping them prepare for what unfortunately won't just be a drill, but could be part of their reality. Dr. Mayer, so as a physician, your role was to provide medical care at the refugee center. But these patients, but these patients are also emotionally traumatized. As you prepare to leave Poland and return to Israel, what impressions would you like to share? And what stories can you tell us?
Thank you, Diane. Thank you for the great question. And thank you all for the opportunity to express my gratitude to be a part of these humanitarian missions. I had the honor of taking refugees at the clinic at the biggest refugee center at the Polish border. As Dr. Yarit already described the routine work at the clinic, I will try to share with you some of the emotional experience of working with the refugees there. Most of the refugees coming to the clinic are in great stress. Reassuring and creating a safety network is the key for treating them. Showing a lot of empathy and calming, explaining about the future, about their rights in the Western world, treating exacerbations of chronic illnesses and acute bruises, supplying medications, all of that, along with calming and showing love and respect for them and for their country. The work with the great staff under the umbrella of Hadassah Medical Organization and Hadassah International was nothing less than amazing. It's that meaning being a doctor is helping to people in need, and the Ukrainian people are in great need right now. I can share some of the stories of actual patients we used to treat in the center. One of them is 90 years old, a female from Chernigov area, which is heavily bombed in the last weeks. Most of the city is in ruin, but the lady insisted to stay at home. As she said to her daughters, what a man or a woman supposed to die at the place they were born into, and there is no way for her to run. After a missile exploded in her living room, leaving her almost untouched with small bruises on her face, she was convinced by her grandchildren to leave her home. She crossed the border and she came to the clinic in great stress, without any understanding what will happen next and what the future will be. Treating her high blood pressure and congestive heart failure, which was slightly exacerbated during the journey, and after all she been through, was only the only small part of trying to reassure and calm and showing empathy for her and respect for her country and for herself and for her and for the whole family. This is only one story, and I can tell many more. I can tell a story of 53-year-old female, which has been told that she has a terminal cancer without any further examinations in Ukraine, and she is about to die. And she had a 14 years old daughter, which was with her when she came to the clinic in the refugee center. After they fled, after her village was conquered by the Russian forces. When she arrived to the clinic, the only thing what she wanted to say is what she knows she's about to die for her terminal illness, but she wants us to take care of her child when she will be gone. As we speak, we are trying to manage to find her a better place of staying in Poland, and to show her that maybe the illness is not so terminal when you have an access to Western medicine. And we help them greatly finding them a home at a good Polish family and sending her to oncological ward in a big Polish medical center. And there is many more stories to tell, but I think the time is short. I want to thank you all again for making this possible. And thank you for all your great donation of making this humanitarian aid, which is so important these days, possible and acceptable, and the mission.
Thank you, Dr. Mir. And before you leave us, tell us a little bit about the children that you're encountering. We know that most of the refugees are comprised of women and children. How are the children dealing with all of this?
So, treating children's stress, it's very complex process. Some of the children can repress their emotions and show none, like nothing is happening and everything is normal. And some are in great stress, and some are many children with some chronic disabilities such as autism or some other neurological disorders are in great exacerbation and need to be calmed and reassured very often and supplied with chronic medication. And you can see that you're doing so much work with that on every angle. It's so easy to do good. It's just reassuring, just showing a safe place for a child. It's already so much. You don't need to know medicine to do that. You sometimes just a human being. I'm not a pediatrician, but during the mission, I treated a lot of kids with lots of different diseases, also medically, but mostly psychologically, mostly stress relief, mostly reassurance, but everything is okay because many of them are without the father with them. Father is usually stayed in the Ukrainian army, and it's only the mother and the grandmother. And to see, for them to see sometimes a male figure just to play with them soccer for a while or doing something like that was of great effort. So again, I can only thank you for the opportunity of doing that. I just about to finish my role in this mission, at least for now. And it was one of my greatest experience so far, also as a doctor and also as a human being.
Well, thank you, Yarit, Julie, and Mayor. Thank you all for bringing this mission to life to us today. We're so proud, humbled, and honored to be part of this emergency response. It's part of the DNA of HWZOA, the Women of Hadassah, Hadassah International, and Hadassah Medical Organization, where medicine has no borders, and we're all about saving lives, one patient at a time.